My name is Dr. Ron Adams, and tonight we're going to talk about restless leg syndrome. Now, if you're watching this video, more than likely you already have been diagnosed with restless leg. It's something that keeps you awake at night. Most of the time when people have restless leg, that's when it affects them the most. Well, what we're here to do is to find out, or help you find out, what is the cause of your restless leg syndrome and what we can do to help you correct that. Now, most people that I have seen in my office that have restless leg syndrome have tried pretty much every medication that's out there. They've tried every type of therapy that's out there, or most every therapy that's out there. We offer something different. We deal with the patients that have restless leg syndrome with a neurologic base and a metabolic based treatment plan. What we're looking at is it something that's up in the brain that's causing it? Is it something that's down in the what we call the metabolic system of the body? Is it the gut? Are we having a problem with the adrenal glands on top of the kidneys? Are we having a problem with cortisol levels? Are we having a problem with blood sugar levels? One of the things that we do a little bit differently is we look at your blood work in a more specific, or what we call a functional way. Most of the blood work that you've had done in the past shows that everything is normal. Well, if your blood work is normal, why do you still have restless leg syndrome? We want to find out, is there something in your system that's basically working wrong? Once we can find that, then we can take steps to help correct you and not your condition. I'm here to tell you I'm going to treat the condition. I'm not going to treat the symptoms. Symptoms are easy to cover. We can take a pill for this, we can take a pill for that. But the pills are only masking it. If we want to get to the core of the problem, we want to fix the core of the problem, we have to deal specifically with you. So we want to find out neurologically if this part of the brain right here is overfiring. That little sucker right there is called the mesencephalon. What the mesencephalon does is it upregulates things, or it speeds things up within the body. If you've ever had those evenings where the night you just can't sleep, usually 9 times out of 10, if it isn't because you've drank too much coffee or something of that nature or watched too much TV, it's because that mesencephalon is just speeding up, and that keeps the brain racing and that keeps us from sleeping. Well, the same thing can happen with restless leg. If that mesencephalon is overfiring, it's getting the muscles twitching. Leg muscles are much larger than the rest of the muscles in the body, so it's much more noticeable. The other thing we're going to look at is oxygen levels. Our brain and our body needs two things. It needs fuel and activation. Fuel comes in the form of glucose and oxygen. Activation is electrical impulses that are generated within the brain and within other tissues within the body. If we don't have that good electrical signal, if we don't have good fuel in the body, then things are going to work out normally. Restless leg is one of those conditions that is frustrating. The reason that it's frustrating is because you go to bed at night, it's 10, 11, 12 o'clock at night, and you're tired, but you can't sleep because your legs are all over the place. Your partner can't sleep because you're kicking, he or she, and sometimes you kick them right out of the bed. So what we want to do is we want to go back and we want to basically go step by step backwards to find out when it started, how it started, and possibly find out what those triggers are. If we can isolate what the triggers are, then we can dive into it much more in depth. Now, this introductory video here is just kind of skimming the surface. We have a DVD that is available. At the end of this section on the DVD, we go into how we basically treat your particular, your body, how we help correct you so that your restless leg syndrome doesn't bother you for the rest of your life. Now, I say this in my other topics also. If you are happy with the medication, this is not the place for you. I'm looking at a different approach. We want to get you better so that you don't have the restless legs, so you can get some sleep at night and you can be a productive member of society again. Again, my name is Dr. Ron Adams. I appreciate your time. One thing that I do want to add, on the left side of this box, there is an information box. We need your name, phone number, and address if you wish to set up a consultation. And also if you wish to get a copy of the free DVD. Yes, the DVD is free. It gives you more information on what is going on. Like I said, the next half of this video is going to show basically what our steps are, and that's contained within the DVD. I hope you have a good evening, and we look forward to seeing you soon.